significant risk factors for incidence of intraoperative complications of cataract surgery with phacoemulsification. And with patients with these risk factors, further preparations and prophylactic measures are necessary.
Thank you. Next paper is with Boris Malugin and co-authors, Cataract phacoemulsification in high hypermetropic eyes. But it's not Boris Malugin who is talking.
I am one of the authors. Good afternoon, ladies and gentlemen. In the given work, the authors presented the developed and put into practice approaches and technique variants of the phacoemulsification procedure depending on hypermetropic eye anatomic and physiological parameters and clinical character of cataract development. We made preparative IOP check, gonioscopy, UBM mydriatics exclusion. Drug preparation, hypertensive drops, angioprotectors, inhibitors PG, peripheral YAG laser iridectomy for narrow anterior chamber angle, or extra laser gonioiridoplasty if necessary for partially closed anterior chamber angle. Intraoperative injection of high-density viscoelastic for stability and maximum anterior chamber recess until intralenticular pressure neutralization. Anterior capsulorhexis was performed through paracentesis using needle 0.4 for a 10th lens. Double capsulorhexis was performed in case of hypermetropic cataract. Dosed hydrodissection and lens hydrodelineation in case of hard cataract was performed after partial removing of the nucleus, synechia division, rigid pupil dilatation using a spatula allowed to achieve sufficient mydriasis for phacoemulsification by phaco-chop. Elastic IOLs were implanted. Results. Generally, phaco was performed according to plan. Anterior capsule linear ruptures appeared in 2 cases. Nevertheless, the surgery was accomplished without complication. Hypertension that required vitrectomy via pars plana appeared in 3 cases. Anterior chamber was deepened and anterior chamber angle extension took place in all cases of the postoperative period. Postoperative transitory hypertension was ceased medicamentally. High visual acuity was achieved in 73% of cases. Low visual acuity was caused by amblyopia, retinal changes. All patients had stable central IOL position in capsular bag. Corneal endothelial cells loss averaged from 10 to 12%. Application of the worked out approaches of cataract phaco considering hypermetropic eye anatomic and physiological parameters and clinical character of cataract development allowed to reduce the risk of intra- and postoperative complications and to improve the ophthalmologic care quality during the patient's recovery period. Thank you for your attention.
Next paper is